Hey Abby,
Hi, how are you?
I'm doing well. How are you today?
Good. We have our visitor again. Remy's here,
Oh, I
nursing.
love it. I love it. How's she
Yeah,
doing?
she's good. She's good.
Girl, love her, love her.
Happy
Well,
Valentine's.
okay, I'm so excited to talk today.
Me too.
And yes, I'm thinking today I'd love to talk with you about this idea of infant mental health, neuroprotective care, and kind of what our experiences with that, and kind of summing it up like I'm an SLP student, you're an SLP and a lactation consultant. And why would we be in these
Setting.
environments like the NICU, and
Mhm.
why do we know about this, right? Why do we know about neuroprotective care? Why do we care about infant mental health? And how does it connect to what we talked about last episode with this idea of attachment theory between parent and child?
Oh, what a great intro. I love that. I love
So
this
much to
topic.
cover
I
today.
get very passionate about this topic, so forgive
I
me.
love it. I love it. Well, just kicking us off, I love this concept of infant mental health because I didn't really understand it. I heard about it in a NANT webinar, and
Mhm.
essentially the speaker was talking about um, that the neural pathways in our brains, right, our adult brains, are actually laid down in infancy, and these things matter. So, can you tell me what you have to say about like infant mental health, neuroprotective care, and then we can kind of vibe off of
Go
each
from
other?
there. Yes, and then I
Yeah.
love to hear because I know you've
Oh,
been
yes.
more in this school setting of researching it and stuff, so I definitely want to hear your perspective. Um, no, I feel like I first learned this concept like 8 years ago, when I was in a student in the NICU, like yourself. And I was a speech pathologist. And like you, I was like, oh my gosh, I can't believe as an SLP, our role could be feeding babies all day in the NICU. And I learned that, it's the same muscles that we use for swallowing and breathing. Those are the same muscles that we use for speaking and talking and forming words. So I understood, SLPs kind of, we have so many different hats we can wear. And so I found out about this niche and was really interested in it. But then as I was there and learning about feeding practices in the NICU, I feel like I got even more passionate about why we are there as
Mm,
therapists, as speech language pathologists, but speech therapists and physical therapists and occupational therapists. And I think
yeah.
it's because we really like, not only do we use those therapy skills and counseling skills to talk to moms and dads going through this challenging time, but we're also like there to be advocates for the babies. And we kind of understand their development and their like how much every little interaction and experience and like the lighting or the sounds or the touch or how much we let them sleep or what if we swaddle them or not or like
Yeah.
which passy we use, like how we facilitate their feeding from a bottle or breast, like all these tiny little things in their day, how that shapes their experience of the world and their mental health. And back then there was this concept of neuroprotective care, so protecting
Mm,
their brain development actually. But now I think they've switched or maybe added on to calling it infant mental health, which I think is just so cool because now there's more of a push in the world for like and more acceptance and less taboo for mental health services throughout the lifespan. But then it's
yes.
like, oh wow, that really starts with even just these tiny little babies. So
Yes. It's
so
so
cool.
true. It's
Yeah.
so interesting. I think both terms, neuroprotective health and infant mental health, like, or neuroprotective care and infant mental health, are sort of synonymous. Like working in the NICU now, they use this term of neuroprotective care.
Mm-hmm.
And even when we're writing notes, we have to justify our
Oh, really?
services by saying we are in the NICU to like
Provide.
decrease, right, to decrease adverse health outcomes for these
Wow.
children, overall saving the hospital money,
Wait,
right?
I love that that has become, I mean, I know it's for like billing purposes and stuff, but I
Right.
feel like, and like, justifying our care. But I feel like that is cool that that has become a like part of your notes, because even 8 years ago it really wasn't. I remember writing, I think it was just starting that we were like, oh, let's start doing passy dips and like intervene earlier to help with the infant mental health, but it was still all related to feeding. But I feel like, and maybe OTs were already writing that stuff, but I don't know, I just love that they're acknowledging and making everyone in the NICU setting aware that this is really important.
Important. And it is. That's the
Yeah.
one question I've gotten when and people aren't in a combative way at all, but
No.
they're like, "What? So you have an internship in the NICU? That's what
And
do
what
you
do you,
do in the
yeah.
NICU? Don't you teach kids how to, do their letters and sounds?" And I'm like, "Yes."
So I
And
sometimes hate that we're as called speech pathologists, because
yeah,
I'll say all the time in the hospital setting, I'll be like, I'm a speech pathologist, but we really work with swallowing, or we really
yes,
work with just overall the muscle development of this whole general region of the
yes,
mouth and throat.
yeah. And it's so
Um,
interesting too, because when we have to write up evaluations, from any child from, and I don't know if this was like this for you as well, but
yeah.
from birth until like 5 years old, you ask what their birth was like. You ask,
Yes.
did they spend time in the NICU? Because the outcomes are so adverse. Like
Yes.
increase in learning disabilities, increase in ADHD, your
Mhm.
like chances of ADHD, like
Tension
all
issues.
of these neuro things because they didn't receive the care they needed in the NICU. Hence, these therapists coming in and
Because not all
the
NICUs
brain.
have all this therapy. And
Yeah.
also, like, because I think we've talked about before, there's different levels of NICU and levels of resources, or even
Yes.
if some hospitals might have a speech pathologist, but they're spread thin, they also see adults. They don't only go to the NICU. So they might not get to be at every feeding or be involved in
Yeah.
every case. They might only be involved in the really sick cases, which those babies might have had issues anyway. And like, what
Yeah.
about the little feeder growers, we call them, which are, sorry, excuse Remy, she's in her talkative phase.
For
You might
sure.
have to be not
Kitty girl.
invited to these anymore.
You're always invited, Remy.
You're always invited, Remy, for your, and like, we know that, for example, right now, like her as a 5 month old, just listening to our voices right now is like helping her language development, right? And same thing with little newborns, like when they're in the, like, I know there's studies where like if they hear their mom's voice, either, there's like physiological effects, and like whether it's calming, or I don't know what the studies say, but like something about like either increase in neuroactivation, or calming of their heart rate or whatever.
Yeah.
Like there are
Decreasing cortisol.
effects, just decreasing cortisol.
Yeah.
Total, there's so many things that like we know is important from moms and dads, but like babies just being near their caregiver, and that
Yeah.
early separation is just not ideal.
Not
So
ideal.
we were talking about this before. We were saying we don't want to be like, Debbie Doubters about this, because sometimes there are medical reasons that babies have to be in the NICU. Like, we're so lucky that we have these life-saving um,
Measures.
medical interventions. But
Yeah.
I do think it's our job as the therapists in that setting to be like, hey, we are the advocates for telling and teaching other hospital staff, parents, like how we can be more holistic and like just preventative care for
Right.
helping them
Despite
get
the
the
amount.
best outcomes. Because one day they're
Yeah.
going to be out of the NICU and they're going to be feeding in a different way off of a tube. And we want them
Yes.
to be able to do all of that with the least challenges possible.
Yes. And
Yeah.
the brain development, I was looking at this graph, and maybe we can put it in the show notes if that's
Mhm.
possible. I have to figure that out. But
You're getting
from
so techy.
32, the cortical folding that happens in one's brain from 32 weeks to 38 weeks, it goes from looking like this smooth peanut to a walnut,
Wow.
and
Mm-hmm.
all of that is happening while the baby is in the third trimester. And
In
so
the womb,
it's
hopefully. Right.
exactly, or
Or
like
outside
for
of the womb.
premature, they're outside of it. And so it's just amazing what the care that little brain needs, whether in the womb or outside the womb. And
Yeah.
so, yeah, just to go like a little bit more into infant mental health, I wanted to read a really fun definition I
Oh,
had.
thank
Yeah, I
you.
know. if you don't mind.
Love it. I love it.
Okay.
Remy's listening intently.
I love it. I love it so much. So, okay. It's the young child's capacity to experience, regulate, and express emotions, form close and secure relationships, and explore the environment and learn. All of these capacities will be best accomplished within the text of the caregiving environment that includes family, community, cultural expectation. Developing these capacities is synonymous with healthy social and emotional development. And that's from 0 to 3 book. And
Love that. Okay, 0 to 3 years.
That's from a textbook called 0 to 3.
Yeah. Okay.
Yeah. And it's really interesting because I love that it said, these capacities with healthy social and emotional development start in infancy.
Yeah. And in the womb, in the having a full term pregnancy gives you the best chance, because then you're entering with all your reflexes at the right time and everything. But if it happens, if you are born earlier for whatever reason, then we need to protect this time. Like, it's so important. Yeah.
Yes, well, you hit on it, that prenatal experiences, whether the baby is in the womb or outside the womb, matter in forming their brain. So, okay, say the baby is in the womb in the third trimester, but the mom is experiencing, the mom experiences a huge trauma, or the mom experiences an increase in cortisol. Yeah, exactly.
Yeah.
That baby is getting used to an increase in cortisol, or when the brain's developing and it has this increase in cortisol, it doesn't develop. It doesn't learn as well when there's this stress in their environment, whether in the womb or outside the womb. And I just think it's really interesting because, again, a lot of things we can't prevent, but what can we prevent? And same thing with feeding. How can we give the knowledge away so that then moms can make the best choice that they can? Maybe my third trimester is not the best time for me to plan a trip to
move
or move.
Yeah, so many people move, right? Because they're like, I'm having a new baby. I'm so sorry. She's a little loud.
I love her.
It's the real life baby life.
Straight up.
Right?
Straight up. She'll be a co-host on here.
Exactly.
We'll list her as a co-host.
I know, exactly. But yeah, no, I totally agree that me. Hi, sweetie. Oh my gosh. I'm trying to see if maybe you just want to talk, or are you grumpy about something?
Yes, ma'am. Well, and also, I'll just talk while Remy talks.
Okay.
Because the reason I feel like I got so interested in feeding is because you see all these a lot of speech delays or language development problems, and a lot of it is based on their child's overall health and nutrition that they're receiving. Yet the mom, obviously, if a child isn't going to eat broccoli or throws up every time they eat broccoli, then you can't force feed them broccoli. But yet they need a variety of foods and vegetables for their language to develop. So it's this really interesting, unfortunate cycle.
Yes.
That you can, neuroprotective care and neuroprotective therapy, and just knowing about when your baby's brain develops and how it develops, you can intervene. You can kind of prevent all of these problems that we might have to address in toddlerhood.
In toddlerhood. Yeah, because I do notice that too. Like what you were saying before about how we always ask for the history. I, for example, when I was seeing toddlers, I would always ask them, what was the birth like, whatever, and they'd be in for whether it was picky eating or a feeding problem, or even older babies with bottle aversion that I used to see, or like you said, language delay. It all impacts each other. Or speech delay, especially because the muscles are affected, how we develop those muscles through eating. So then sometimes if you have some of those speech delays later, maybe the muscles didn't get as much practice with different things. But yeah, like I would always ask, what was your pregnancy and birth like? And a lot of times it'd be like, oh, we had an emergency C-section at like 36 weeks. And, something was challenging about those early days.
Right.
And thinking about that, it's like, okay, so yeah, if I loved the peanut to the walnut analogy you said, like imagining that of like the baby's brain is changing that much that you can
Yeah.
see that difference. It's like, okay, for like my son, for example, who's born at 35 weeks, like all of that happened. The 5 of those weeks were happening when he was in a loud NICU that's like beeping and like, I wasn't there. I was there as much as I could because I luckily got to stay at the hospital. So we can talk about that. Like,
Yeah.
NICUs that allow the parents to stay over are like, that's amazing for
Yeah.
especially for moms who are trying to establish a milk supply and breastfeed, and just hold the baby skin to skin. Like just being able to be there was awesome, but I still had to walk back and sleep or rest or eat in my room. I couldn't do all that right next to the baby. So like think about all that separation that you have, and like it feels awful as a mom, as a new mom. You have so many hormones that are like making you want to be right next to them. So if you think about like that's our reaction to it, it's like
Yeah.
this poor baby that was like in there so cozy. Of course they're going to react to it, but do they show it? No, like they're just sleeping, like they just shut down,
Right.
or they're just tired, like they were supposed to be asleep in there the whole time if they were in the womb, so they just do that on the outside. So that's why
Yeah.
like when you see these, we call them late preterm babies, like 37 to really like 35 to 38 weeks, since we consider 38 weeks full term. But even 38 and 39 weekers are a little bit sleepy still. They're not
Yeah.
like, she came out at 41 weeks and I remember being like, oh wow, like she's alert, she's ready to eat, she knows what's going on at
Yeah.
41 weeks. But like from 35 to 40 weeks, they're so tired. Um, I mean, um, they're they really just eat briefly and then go right back to sleep. And
Yeah.
that's because they're still working on all that brain development that still has to
Right.
happen, whether
Right.
they're in the womb or out of the womb. They still have to get
Right.
developed.
And
Um,
it's not, yeah, and it's not just the peanut is like getting smaller and gets ridges. It's like your brain
oh,
is exploding,
their
and it's
head.
exploding so much that it has to go in, like it has to create these ridges
Yeah.
because it's getting
Oh, that's
so
a good way to
big.
say it. Yeah, because
Yeah.
it's like
Right.
squished by the skull. Like,
Right. Yeah.
oh
Right.
my gosh.
And I love also like moms knowing this knowledge to understand their child now if they did have an acute baby, like the fact that Jacques
Yeah.
might be like as compared to a child who didn't experience NICU, like you can look at him with a different lens, with a
Oh,
more
I totally do.
compassionate lens.
I mean,
Yes.
who knows? I think about this all the time. I'm like, that was just his journey, and I'm
Yes.
glad that he needed to be induced because of like a medical reason. So I'm glad
Yes.
that nothing bad happened. Like he did. I feel like the NICU, helped him get where he needed to go and gain weight and all that stuff. But
Yeah.
um, but I do think all the time about like, okay, was this just going to be him, or is this because of those early experiences? And I'm sure everything is nature and nurture, right? It's like a little bit of both, but it's like okay, like the whole spirited child and like high energy and like just like attention, or yeah, just like trying to um regulate your emotions. And
Yes.
because any toddler parent knows that like that's basically your whole job as a
Yeah.
0 to 3 to 5 really parent. Those first 5 years you're like building your, talk about mental health for that age range, like
Yeah.
you're basically building their ability to like have emotions and then regulate themselves and co-regulate with you, so that then they can, like when they're angry, they don't just hit someone, they like
Yes.
actually can be like, I'm frustrated, and then let me take a deep breath or do whatever I need to do to get my emotional needs met or regulate myself to participate in the world, whether that's school or
Yes.
play date or eating their food or whatever. And
Yeah.
there's so much regulation that you have to do with kids, whoever they are. But I do wonder sometimes if like, yeah, like if they had those challenges in those early years, that might make them a little more dysregulated or whatever.
Yes.
Mm-hmm.
They might need a little bit more co-regulation
Yes.
than your average child or their sibling that didn't experience a trauma right
Right.
out of the first part of their birth, and that's okay. And seeing like, oh yeah, if you're born into an environment where there is, sounds, lots of things going on, then you're going to be more comfortable in that like stimulus, hyper stimulus state,
Mm-hmm.
meaning children with ADHD, like kind of seemingly thrive in that environment. So yeah, it's just the
Yeah.
co-regulation, their needs might be more than someone who didn't. And there's nothing bad or wrong about that. It's just a
No.
better way to care for them, you
Yeah,
know?
and it's also like it just gives us information as caregivers, like when you are in the NICU with them, because I do remember people, or I did learn at that time, and I had known from before being a NICU therapist, like that you should try to like you still want to give them input and sensory input, but you do want to kind of like keep in mind that before, if they were in the womb, they would have had very low sensory input because it would have been
Yeah.
dark. They would have been all in
Yes.
one position. Think about then when they're out, but they're still 36 weeks or whatever. They look like a normal baby, and you're picking them up and you're feeding them in all different positions with all fast flow rates and all this jazz. And it's like, okay, well, they're not only having to breathe on their own and work to eat, but like you're also jostling them, moving them, maybe feeding them with this really fast flow that would be way faster than breastfeeding,
Yeah.
or a slow flow nipple, like, so you're kind of, it's important to, I just think it's cool to imagine like, hey, this is what we would have been. They would have been just in a dark
Yes.
womb. So let's try to decrease the stimulation as much as we can and get them skin to skin with mom, co-regulating with her breathing, like
Yes.
try to decrease the separation if at all possible. Like,
Yeah.
if there's a traumatic birth, maybe the baby's 39 weeks, but it's a C-section. Hey, can we do a gentle C-section and try to have the baby right on mom's chest right after, like, and not
Yeah.
just separate for
Totally.
3 hours? Because like that
Yeah.
seems like, okay, what's the harm? The mom's recovering from surgery, the baby can go be with dad, and like we'll start breastfeeding at 3 hours and it's no big deal. And it's like, no, that is actually
No,
like
there is a
not
harm.
good. That is not,
Right,
I mean,
right.
it's okay. And if anyone like has had this experience, like I'm talking about my own experience too. Like my son had, not I do think we had a little bit of a traumatic, or just like not ideal birth situation, having to come early. And if you did have a C-section, like you probably needed it, like but it's like, how can we help medical communities and parents just try to avoid these things if we can, or just make them better, like make them as
I think
better,
it's
as
okay to
good as
call
they can.
something, pardon me, yeah. I think
Yeah.
it's okay to call something traumatic,
Yeah.
traumatic. You know what I
Yeah.
mean? Because then you can be like, okay, now what do I do to pick up pieces? What's worse is when something traumatic happens to you and everyone's saying it's not traumatic.
Oh
That
my gosh.
is, that is like kind of throwing fire onto an already flaming, bonfire.
Oh
And
my gosh. We should get this. We should get like a therapist on here one day, because I am so passionate about that. That's what they always say about kids too. Like if you like yell in front of your kid, like every mom, I feel like now with all the gentle parenting is like, we're trying not to yell, right? But like, of course, sometimes you might mess up and get
yeah,
frustrated in front of your kid, or maybe someone dies in your family and you like are crying in front of your kid. All therapists always say, they're like, kids aren't afraid of like seeing you have emotion, or they're
yes,
not afraid of that. They're afraid of being alone to process it and not
yeah,
knowing how to process it. So like, or to not getting the validation for their
yeah,
fear, or like kind of
so
like
true,
what you're saying, like,
so
okay,
true.
if
Yeah.
something's traumatic, that's fine as long as we process it and validate it the right way.
That's it. I was listening to
Yeah.
this mom, and she is actually a clinical psychologist and
Mhm.
and focuses on infant mental health. And she went back to school after she had a NICU baby,
Mhm.
and she actually, I think her child was around 4 or 5. She
Mhm.
actually simulated the birth again, like with the
Oh.
child, and so she would do things like swaddle her
Mhm.
4 or 5 year old,
Oh.
and and like just all of these things that it's skin to skin, you know, like all of these things that were
Not interrupted or
taken from them. Yeah, exactly. In the birth, that she was able to give that again because she said, we both experienced a trauma. Let's see
yes.
how can we recover from it. And that's what I mean, trauma experts like, you
Always
know,
say, yeah,
right, the body keeps the score. Like you
yes,
need
that
to,
book. Oh my gosh, such a
yes.
good.
And so anyway, I feel like
Wait,
it's
a point on that, just to say, I did
yes.
like a rebirth experience with my son. Oh, are you still there? Yeah.
Yes.
Oh, sorry. It just Remy was trying to exit out.
He said bye.
Glad she didn't end it. No, but like a few weeks after we got home from the NICU, I was like, I had heard about that, and I like took a bath with him and like did like a
Beautiful.
rebirth experience or whatever, or just a moment to be like, okay, look, like I wish that we got that skin to skin right after birth.
It
So let's do it
matters.
now. And then same thing with like we baby wore for like years. I feel like that's just a
Yes.
way to like rebond, or if you didn't
Yes.
get the breastfeeding experience that you wanted, like get trying to like make bottle feeding or baby wearing or something like a connection point. I think that's,
It's
I don't know.
beautiful.
I think it's very valid.
Yes. And I also recognizing that infant mental health is so important. And also there's still neuroplasticity, right? Like
Yes.
your brain can still
You're
change,
not
which like
damaged forever.
right, exactly. I think that is so important, like in learning about these things and not being afraid to say, like, yes, you experienced a trauma at birth or your child did or whatever,
Mhm.
and you can recover. You
Yes.
can create these
Rebond.
very salient sensory experiences for your baby and for you to
Mhm.
rebond, to put new sensory information in that even makes it, better than maybe if it didn't happen at all. Like,
Yes.
uh,
It's like any
the
challenge we
repair.
experience, like any challenge, like it's like, okay, you're not raising this child to like have a perfect life and never have any challenges. Like you
Right.
do need to, part of parenting is like preparing them to be able to handle challenges that
Yes.
they get. And so I feel
Yes.
like this brings it really full circle of like, why do we care about infant mental health in the NICU? It's like, because not only it's your first time with your baby and it's your first in whether you're in the NICU or not, like you could
Yeah.
have a traumatic experience in another way. And it's like,
Right.
okay, how do we just tell parents ways to help babies mental health so that you
Yes.
form that strong attachment, get over any challenges that you are having, and then
Right.
like have a good foundation for your feeding relationship, for your parenting journey, like all of it.
Yes.
Mm,
Yeah. The rupture and repair, which
yeah,
will happen in any
yes,
relationship
exactly,
ever. And
exactly.
it's good, you know?
It's good because it shows that you can come back. I was, my little son was saying the other day, he was like, Remy, you don't have to cry. You know that mommy always comes back. And I was like, that's true, Jack. I was like, um, yeah, like I think that's something that toddlers start to learn. Like, mommy always comes back. Daddy always comes back. We always come back. We always come back. And
Yeah.
that builds their attachment. But babies just don't have that much experience yet. So they don't know that. So that's why they cry every time
Right.
you leave the room. They think
Yes.
we're coming back.
Yeah.
So we
And
have to
if that
build,
repair, oh, go ahead.
we have to build that pattern for them.
Yes. Yeah. And if that repair doesn't happen, then it's like then you have like an anxiously attached child, and
Mm-hmm.
even that can be repaired. Like anything can be repaired. Recovered anxious attachment, girly.
Oh, yes, yes.
So anyway, yeah.
I
This
love
has
it.
been amazing. I feel like we
I
could go
know.
on and on.
We could definitely talk about this more. I feel like let's continue about the NICU and about infant mental health. Even if we touch on it in further episodes, this was a great foundation.
I
Um,
agree. I agree.
I
And
love it.
Remy, you are so welcome. I love
Remy.
your input.
Yeah, thank you for all your babbling. You can tell she's learning. She's starting her speech development.
The vocal play, we love it.
Local play. All right. Well,
Well,
good to
thanks,
see you,
Abby, so
Catherine.
much.
This was great.
Alrighty. See you next time.
Bye.